clinics, that's not going to be charged to the patient. It's already been paid for. So don't let anyone, because there's people that put out misinformation saying they're going to charge you $2,800 or something. That is just not true. And you wouldn't want that misinformation to dissuade somebody who this could help to then not want to come out and get the treatment that they need. And so, again, this is something that, as we've seen a lot of breakthrough cases, as we've seen waves, not just in Florida and the Sun Belt, but, you know, Hawaii, Oregon, these places. Israel is one of the most vaxxed places on the planet, and yet they're having these waves. So you're going to end up having to say, okay, you know, if you're high risk, if you're vaccinated, you're reducing the likelihood you're going to be hospitalized. But at the same time, people are getting infected across the board. And so what happens if that happens? This early treatment is really the way to go. So we appreciate the fact that these sites have been able to be rolled out very quickly. We use the emergency management model. We respond to hurricanes, other things. It requires a lot of logistics. So we apply that to a lot of the things we've done from COVID, whether it was the nursing home strike teams we did to help test the seniors very early on, whether it was some of the things we did with vaccine distribution, you know, doing things with churches, doing things in senior communities, doing our Homebound Seniors Project. You know, that required a lot of logistical know-how. So now we're applying that to the monoclonals to make this something that's available for people and something that can really make a difference. And so I want to thank everyone that's been involved, and I'm looking forward to this site starting to treat folks and help folks out starting tomorrow morning. I have Kent Shepke here. He's the Chief Medical Officer for Florida's Division of Emergency Management, and he's working very closely with all these sites, making sure that they're treating the patients and making sure that the logistics is running smoothly. So I'm going to let him come up and say a few things about the monoclonals.
Thank you, Governor. I think we just learned recently that Pfizer got full FDA approval, and the reason why I bring that up is because in addition to the monoclonals, which is our treatment arm, we still have our vaccines, which is our best prevention arm. And I know a number of folks have been sort of waiting to see how the vaccine rolls out, and some of them were waiting for that full FDA approval. Now we can say we've had millions of Floridians get this, hundreds of millions of people get the vaccine worldwide. And as the governor mentioned, the vaccines are still holding up really well to prevent severe illness, hospitalization, and death. So if you're one of those folks who are sitting on the fence waiting, I think now maybe with the FDA approval, maybe it's time to take another look at that, and I encourage you to get the vaccine. But the vaccine, while it protects you, will take up to 6 weeks to develop that protection. And if you get infected today, what's really been missing in this response has been the treatment arm, and thank you, Governor, for getting this treatment out there, because it's sort of been one of those best-kept secrets in COVID about this really effective monoclonal antibody treatment, which would work today, meaning we can give you these antibodies, they directly target the virus that is attacking your system, and it can reduce your chance for hospitalization and death by 70%. And we've already seen lots of success stories from around the state. In fact, many of you may have seen that photo of one of the women that went to our Jacksonville site to receive treatment. She was laying on the ground, feeling really ill. Well, I had the privilege of getting to speak with her today, and she tells me that she has some underlying medical conditions that prevent her from getting vaccinated. She unfortunately contracted COVID, and she was just getting sicker and sicker as the days went on. And fortunately, her mother had been following the governor's press conferences and knew about these monoclonal antibodies, and she was able to get referred to the Jacksonville site where she received treatment. And today she told me she's feeling so much better, and she's convinced had she not gotten that Regeneron treatment, she would have been one of those people in the ICUs on the ventilator. That's how bad she really felt. So thank you, Governor. I appreciate it.
Yeah, and you're now starting to see other states follow Florida's lead. So, you know, just at the beginning of the pandemic, we focused a lot on nursing homes, not letting hospitals send the sick patients back there and offering protection. Then when it came to vaccine, we were at the forefront, the first state to put seniors first in priority line, first state into nursing homes for vaccination, first state to partner with faith leaders and churches, first state to do the senior communities where we come in and do thousands of seniors, and the first state to really do a broad retail pharmacy footprint, which has made it much easier for a lot of people. So now the first state to really lean in on this. It's necessary. It's helping. It makes a big difference. It was always been available, but not necessarily with the visibility that we would have liked, and understanding, if you're not somebody that has COVID, obviously more people were focusing on the vaccines. That was something that makes sense. But we are where we are, and I think we're seeing that this can make a difference. And again, of the people that have been admitted to hospitals this summer, over 90% of them did not get this monoclonal antibody treatment. And so if they would have done that earlier, it's my belief that many of them perhaps could have been kept out of the hospital. So now more people know about it. They know it's free. They know it's been effective. The testimonials continue to roll in, and we think that this will be a one tool, not the only tool, but one of the tools that we have to be able to help people and help them, particularly if they become infected, which, if you look at this Delta, how it's moved, you look at the United Kingdom, you look at India, you look now in Florida and other Sunbelt states, you look what's happening in Israel, this is something that's very, very contagious. It's aerosolized. It's something that most people will at some point come in contact with. This is going to end up being an endemic coronavirus, and so understanding the prevention arm and then the treatment arm, and who knows, maybe we'll get even better stuff down the pike. But certainly for now, these are great tools to have both on the front end and the back end. So we've put a lot of effort, of course, into the distribution of the vaccine. Now we're putting effort to raise the visibility of the treatment and to provide people access to that, and it is working, and we're going to continue to use this as long as there's demand for it. Okay, with that, I could take a couple questions. Yes? Because we're looking at the west coast of Florida, and we're trying to just get them into the population centers where most people would have a relatively easy drive. I mean, I can't say it's going to be 5 minutes from everyone, but we did the one in Bonita Springs, thinking that could draw a lot of Naples and part of Lee County. And then here, Charlotte, we think we can get southern Sarasota, Charlotte, and maybe even it's like Cape Coral and some of the northern parts of Fort Myers. And then we have our Manatee one, which we think can get the northern part of Sarasota as well as southern Hillsborough. And then as you go, we do have one in Tampa, which will be kind of more the urban area. And then we have one in Pasco, which we think can get not just Pasco, but Hernando and Citrus on that west coast. We are going to have one in Leon very soon, in Tallahassee, and then we have one in Panama City and in Fort Walton Beach. And so that whole west coast of Florida, you probably are, I would say the vast, vast majority of people are probably within an hour drive of one of these sites, and that's what we're trying to do with it. Yes? Well, I think it's both. I mean, I think when we started doing this, we got a lot of people reaching out saying, hey, we would definitely like that. And so, so it's a combination of both. And I think that the health systems really like it because they've seen the same, the data that we get is what they have, and they see the patients that are coming in, most of them have not been vaccinated, and most of them have not gotten the monoclonal. And so we're in a situation where if you're COVID positive, you have an opportunity to get an early treatment. And so I think you'll see when this site opens, the patients that come in, I do think you'll see a decline in admissions as this site really takes hold in this area. Yes? Do you plan to open any more statewide testing sites? So we're focusing on the monoclonals, and the reason is because the commercial tests, you could go get home tests now. They're very readily available. The monoclonals are have not been as available. They are available from the health systems, but of course, if you're doing the IV, you may only have limited slots, and then some hospitals will offer them, but they may only offer them once a week or something like that. We think it's important to have it 7 days a week. So this, we think, is the way to make the biggest impact in terms of what's happening to help people, and I think that is already being borne out. Take a little bit longer to really get the firm data, but we're very confident that the data will be positive on this. And again, other states are now doing it. I think there's been a recognition that this has been underutilized. Now, part of it is some people say if you talk about early treatment, then some people are going to construe that to mean, well, why would I get vaccinated if I could be treated? That's not the message anyone's sending. Whether people take that or not, look, at the end of the day, we have to give all the information. We have to provide access to all these things. Of course, if you want a vaccine, just go to CVS and get it. It's free. And the same with the monoclonals. And so I disagree with people that say you shouldn't talk about early treatment because that may cause somebody to say, hey, I'll just get the treatment instead. You got to give them the information and let them make the decisions. But just think of all the people who could have had this who just didn't know about it. And that's really, I think, the biggest thing we saw when you started to see these admissions really go up was people just didn't know to ask about this. The results have been very good, and so we think that this is really going to make a difference, and we'll continue to support it as long as there's demand. You know, we've done, I mean, we'll probably hit 10,000 treatments, you know, within the next day or two in terms of since we've had these out. You know, so that's a pretty significant number of treatments. We're doing, none of them are selling out necessarily, but we do have some that are largely booked. And if you think about it, I mean, you do 250 treatments, that's a lot. Particularly, I mean, if you do 250 treatments in Charlotte County in a day, that is a big, big deal. I mean, let's just say that half of those people were would have been hospitalized. Now, maybe it doesn't work for all of them, but if it works for a big chunk of them, that is a lot of admissions that you're protecting against. So it's a really, really big deal. So we think that this is innovative. We think this has been underutilized, and we want to bring this tool to the effort. And so that's what we're doing. All right. Well, thank you, guys. We'll be back soon. Hopefully, we'll have some good testimonials out of this site. So thanks, everybody. Appreciate you. Yeah, thank you. Thanks. Appreciate you.
So, we're having an issue. Joe, is that without a prescription?